Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. In this episode of the Knee to Know Show, we're going to talk about the topic of bioplausibility. What does it mean and how does it apply to you and your knee replacement surgery? Hi everyone, Dr. Luke Peterson here, physical therapist. So today we're talking about bioplausibility. And this is a phrase or term that is used when referring to things such as medication, such as medical treatments or medical procedures. And basically what it is looking to see if, based on your intuition and based on logic, does it make sense or does it suggest that that thing should be effective? So should that medicine, should that treatment or that procedure seem to be, based on your intuition and logic, be an effective type of treatment? So, for example, something to think about is with your knee joint. For example, there's surgery, arthroscopic surgery, when you have, we'll say, a torn meniscus. So someone does an x-ray or imaging of your knee, and they show that there are some tears, some degeneration of your meniscus, the part of your knee that sits on top of your shin bone, provides shock absorption, can often be torn for one of many reasons. So they see that there's a tear. So a lot of times the thought is, well, let's go in, let's have surgery. Arthroscopic surgery will take out that tear, will take out that broken part, or will repair the meniscus in some cases. And then after the surgery and after some rehab, you'll feel better because, based on intuition, this makes sense that this would be effective. Same thing for a knee replacement. If you have a lot of arthritis in your knee joint, so there's swelling, there's damage and destruction to the cartilage, there's narrowing of the space in the joint, and you have that bone-on-bone sensation and then bone-on-bone symptoms. You have maybe some bone spurs developing, things of that nature, then it would make sense intuitively that if we go in, we clean up all the arthritis, clean up all the degenerative changes to the cartilage and the meniscus, and we put in a brand new knee replacement with new components, that would then lead to not having that pain and those symptoms from the arthritis anymore because we've now eliminated the arthritis. And the thing to think about, there can be many discussions about this topic in terms of, positives and negatives and how you should think about it. But for us, individuals with knee pain who are either considering knee replacement surgery or preparing for knee replacement or already had knee replacement, you want to think about the fact that although there's bioplausibility, although our intuition and the logic would seem, okay, I have a knee replacement, I've gotten rid of that, the damaged parts, the damaged torn cartilage, the bone with the arthritis and the bone spurs on it. We've put all these new components on it, so I'm good to go. I'm not going to have pain. I'm going to feel better. I'm going to have a great outcome from my knee replacement surgery. And the thing to remember, though, is the human body and your experience of pain, and pain itself is much, much more complicated than this. We wish there could be this one-to-one cause-effect relationship. It would make things a lot easier. It would make the medical field, it would make physical therapy, orthopedics, all these things so much easier. But the body is much, much more complex than that. And there are multiple factors and multiple things that play a part in our experience of symptoms, our experience of pain, stiffness, swelling, all of these things. There's a lot of different things at play. I've talked about in some previous videos, you have to consider there's the mechanical considerations, the biomechanics, the physical stresses that are occurring at the knee joint, but then there's also the systemic and the biological changes. So there's things with your hormones, and there's things with the levels of inflammation and things throughout your body, and your body weight and the health of your cardiovascular system, and all these things play a role. And then moving on from that, there's things like your environment, there's social aspects, there's past experiences, expectations of the outcome from surgery. There's so many different things that are playing a factor. So the idea is that, yes, from a bioplausibility standpoint, it makes sense that we go in, we take care of the arthritis, we fix up the knee joint, resurface it, you're going to feel better. But it takes a lot more to actually feel better and have a great outcome. It takes a whole holistic, whole body approach, looks at everything, looks at lifestyle, looks at your activity levels, looks at your mental and psychological health and well-being. All these things are important and play a role. So I guess the take-home message is make sure that you take a broad perspective and broad look at everything in your total health when it comes to preparing for recovering from knee replacement surgery. Because just because we're changing what's going on with the knee joint and it seems logical and intuition would seem that that's all you need to do, there's really so much more to the picture and so much more that can be addressed that can help you in terms of if you're taking a proactive approach and looking at these things to help you have a better outcome and a better recovery from knee replacement surgery. Thank you very much for watching, everyone. I post videos every day here on the Need to Know Show. If you like our content, head over to YouTube. If you're not already there, hit that subscribe button so you get each video and can watch each one that I post. Thank you very much for watching, everyone. Have a great day.